Now, this show is about leadership, Moxie as well. Can you define leadership in the great English lexicon, as I would like to call it, or medical management maybe in this case?
Yeah, so everybody has their definition. For me, I think, because, you know, there are certain personalities that become leaders, you know. There's a book called The Charismatic Leader, you know. So I think it's, you know, about being a visionary. Because I think that at the end, with leadership, you have to start with a vision, and you have to have a path that you're headed towards. Even though there's gonna be lots of turns in that path, you're trying to find your way to something, and you have a real sense of desire to really get there, a real drive, a real need to get there for that. And so you have to have the vision. And then my philosophy beyond that is, in getting there, is to lead by example. And so really, as I've traveled through my career, it has been to not ask others to do something I'm not willing to do. I'm often the last one to leave my office, the one to work harder, to be involved more, to not really believe that anybody's gonna do it for me, that I'm not gonna somehow magically be successful, but to know that hard work and really sharing in the process and not demanding all of it from others, but from myself mostly, is that. So I just try to walk the talk and be a real leader by example.
How do you handle a prospective patient or client where, to be quite blunt without mentioning names or singling out any kind of disorder or whatever, they're just mentally not in the right place, and you know that, and they're asking you to do this or that procedure? How do you deal with that, or how does the profession deal with that? Because I would suspect that you do run into that, or people that maybe have one too many when they start having one and they have two, three. And I would just want to get your opinion as a leader, because that, you know, resistance is always the hardest part of leadership in my opinion.
Well, one thing that comes with success is the ability to say no to people and not really care financially. So it is a joy out of success to be like, I don't have to do these surgeries. I'm not like worried about paying rent next week to do that, so it's successful. But I think I always remember that once you operate on somebody, you own them, right? So you should spend way more time doing an initial assessment of the patient and really spending time talking to them and looking for red flags. And so when we see red flags, they either can be to me or more often to my nurses. They can be on their best behavior in front of me, right? And they can be in their best behavior. We listen to those comments and those red flags, and you know, the answer is to really avoid doing those patients if you see them. You know, there's something called body dysmorphic syndrome that we define.
That's the one.
You know, which is like, that, you know, they're never skinny enough, they never, you know, skin's never tight enough, you know, all those things. We see it with facial surgery too. They're overfilled. How many times have you been at a party and seen somebody who's got a sagging face, but they try to fill it all up to make the sag go away, and they look not better. They look, you know, sort of surgerized in a way. And so I think that, you know, I don't want that on my name on that particular thing. So I think I'm always thinking about, you know, taking care of the patient. It always comes back to what is best for this patient. And sometimes it's best to say no. And I just stick to that. And, you know, I don't have to be a pleaser. I have to keep them safe even when they don't know how to stay safe. It's my responsibility. And so I do that. So sometimes you just say no.
Well, I appreciate you sharing that insight. I think it means a lot.